I've just fallen off a step ladder and I'm in extreme pain at the top of my leg. And actually, when I landed, I heard an awful crack. I think I might have broken it. I wish someone would come and help me really quickly because I'm in terrible pain here.
Okay, John, we're up to it again.
I've fallen off this step ladder, mate, and the top of my leg is killing me, and I'm going dizzy, and it's awful.
Right.
I feel terrible.
Okay, so again, in terms of making an assessment on John, what I need to do is first of all establish the mechanism of injury. What did you actually do to...
Well, I was on that ladder, and I was trying to reach that top window, and I just fell off.
Right, and how high up on that ladder were you?
Oh, I must have been about 15, 20 feet, I don't know, It's quite high.
Right. It's a significant mechanism. So obviously, one thing I might suspect with that kind of mechanism is, again, is spinal injuries. For the purpose of this, we'll assume that we've managed the spinal injuries in terms of the principles that we do before. So my first principle would be to pretty much ignore your leg injury at the moment.
Right.
Get your head immobilised, get you collared.
I've no pain in my neck or back, it seems fine.
Regardless, at that height, we would treat you
would still do
a
that.
mechanism.
Okay.
Yeah,
right.
yeah. So we'll presume that's being done.
Okay.
Okay, and we'll look specifically at your leg injury in this instance. So, what I'm observing your leg for is for if I can see any visible deformity.
Yeah.
If I could see any
shortening.
If you straighten your good leg for me,
Yeah,
what I'll be looking for is comparing the legs to see if there's any shortening of the limb that's there.
Right.
I'll be getting you some pain relief.
Oh, good.
Probably in terms of gas and air initially, possibly putting a line in, giving you some morphine, some metoclopramide to control your pain.
Good.
But one thing that I can do to actually control the pain, if I suspected that this was perhaps a mid-shaft fracture of your femur, is I can actually put some traction on that.
Right.
And what that will do is basically two things. It will reduce the amount of pain from the broken ends of bone sort of rubbing and compressing on nerves and things like that, which might be causing your pain, and also to improve the circulation and prevent any hemorrhaging from the limb, because obviously you can bleed quite a lot from into your femur.
That's probably why I'm feeling so dizzy.
Yeah, so you're likely to become quite shocked fairly quickly. So what we can do is minimise the amount of hemorrhaging that we get from that injury by placing it on traction as well. Okay, so I'll be assessing your limb, looking at the colour of your limb, looking at its temperature, trying to feel for your pedal pulses, things like that in terms of doing my assessment. And if I'm quite happy that what I've established is a mid-shaft fracture as opposed to a neck of femur or a joint injury, which I don't want to put on traction, then I'll be quite happy to put you on some traction. And one form of traction that we use very hospitably is there's one called the Donway traction splint. Right. So we'll apply that and see how we go. Do you want to just sit back and just relax a little bit? That's grand. Okay. So
every movement's really painful.
The first thing I want to do is to actually pop a brace around the top of your leg. So I'm going to have to feed that underneath if we can. That's it. And there's a strap that just goes over the top for that. And then what I need to do is to, obviously, you've got some quite strong leg muscles which, when you fracture your femur, can pull the bones and shorten them. So quite often what you'll find is that what we're actually doing when we're applying traction is actually pulling them back out and back into alignment again. So you need quite a bit of force to actually do that, a little bit of control over it. And in first aid principles, what you could do if you felt that a limb was in jeopardy, we could just apply manual traction just by pulling on your leg. But it takes quite a bit of exertion to do that and to keep that on. So what we want to make sure is that when we do apply this splint, that it's not going to move when we start to apply traction, your foot's not going to pull away. So the traction splint is basically designed to be adjustable to any lengths. It's got some screws on here that we can undo to adjust the length of it here. So we're going to introduce it on the bottom. We can do actually, make life easier. As you can see, at the bottom of the splint, there's a harness and a strap to actually attach your foot to. So the first thing we want to do is to introduce that in. Obviously, I'd be encouraging you to use your gas and air for any movement that we're going to do, because any movement is going to be sore. But we need to get your foot flat against that base plate at the bottom if we can, first of all. And then what we do is just apply a figure of 8 strapping over that, keep that secure. Next thing I want to do is to bring out these extensions on the splint and feed them into there. Make sure that they're off. Give you some support to your legs by feeding these straps underneath them. And often it's useful to use the hollows, so under the knees, a good place to try and sort of feed things through. What these straps do is just to give you a little bit of support as it's applied. Okay, and then what I have here is a pump which is going to apply the traction, which is going to extend these poles. So what it's doing is actually filling this frame with air, which means that these poles are going to start to gradually move up. Because your foot's attached to the base plate, it will stretch your limb and apply some traction. So I'm going to start to apply a little bit of pressure, and you can see that as I'm doing that, the poles are coming up.
I can feel that moving.
So you've got to be careful, especially in gentlemen, as you're applying this, that we're not catching anything. It feels comfortable. And the main thing that I'm going to use as an indicator of when I've got this enough traction is when you start to feel some ease from the pain, primarily. And also I can use as a little gauge on the machine that I can use just to establish how much pressure I've got in there. So I'll keep on doing that until you tell me that you're feeling a little bit. And what I'm observing for is just to make sure that that foot remains on the faceplate, on the foot plate, sorry. Because what can happen is that as I'm pulling and applying the traction, that can come away. So I need to make sure that stays on, that's nice and secure and firm. How's that feeling?
I think it's starting to feel a bit better now.
Okay, and you can see that I'm just actually reaching the green section on the gauge now, which sort of ties in quite nicely that we're there. So what I need to do now is I just need to lock off this frame so it stays in the same position. So I'm going to tighten these screws here, which kind of locks it off. And what I've got, if you like, is a charged frame. It's got air in there. So obviously, if somebody was to try and disconnect this later on, what can happen is is that one part of the frame will shoot out. So I need to get rid of that air. So I just press a release valve on here, which gets rid of the air that's in there and keeps the frame just as it is. If I needed to redo that and apply some more pressure, all I do is unlock those, apply some more pressure, and
certainly better now. Can I be moved now?
And now we can move you. Another thing that we'll just do, just to finish, is just to lift the frame up and elevate it on its stand there. Okay, and now we can get you moved. Obviously, it's difficult sometimes to move people when you've got these frames in place. It is a tricky manoeuvre, but it's just a case of combining this with the rest of your patient management, so pain relief, fluid control, fluid therapy as well.
Great, thanks, Craig.
Okay.